Hello, I am Dr. Mahadevan. I am a medical gastroenterologist. I am going to discuss about the most common and important topic is a dyspepsia or something called indigestion. Dyspepsia is defined as upper abdominal discomfort or a pain which is associated with following a food intake or following some medications. And patients with the dyspepsia, they can have different kind of symptoms, especially they can have a bloating or upper abdominal discomfort, they may have a burning sensation, or they can have a regurgitation or a reflux. These are the most common symptoms of a dyspepsia and indigestion. They feel that they are unable to digest whatever they have. When you look at the causes for dyspepsia, the important causes are mainly food intolerance. Mainly a faulty food habit is the most common cause of dyspepsia, and other things are all medications, other systemic disorders, and diseases which involving the GIT, mainly the stomach, biliary and pancreatic disease. All these causes can dyspepsia. Food intolerance, when you look at the food intolerance, mainly people are eating outside food and taking all fast food items along with the excessive fat, which leads to indigestion. When you look at the normal physiology, the stomach generally, whenever you eat some food, it accommodates food in the fundus and mixes with the acid and push the food into the small intestine for the further digestive process. Generally, it takes 2 to 3 hours in an average, at least to empty 70 to 80% of the food. Generally, because of fat, excessive fat what we eat, generally it delays the emptying process that can lead on to kind of an indigestion that can happen to any normal individuals. When it says a pathological, whenever you eat even a small quantity, they feel heavy and they are unable to digest. They can have excessive belching or a heartburn or some kind of a burning sensation in the abdomen. And reasons for other medication induced dyspepsia, normally when patients, cardiac patients are taking an aspirin or people taking painkiller medications which leads on to dyspepsia. There are various other reasons which are include thyroid disorders, hypothyroidism, or diabetic patients with the long-standing diabetes can cause diabetic gastroparesis. They can present with the dyspepsia because they are unable to empty the food from the stomach into the small intestine. And other diseases, if you look at the organic diseases, what we are always fear about dyspepsia, we always think in terms of a cancer or an ulcer. That is not true. That only accounts for 30 to 40% of the patients. When you look at the pathological causes, common things are all peptic ulcer disease, gastroesophageal reflux, and malignancy which involving the stomach as well as the biliary system. Sometimes patients with the stones in the gallbladder or a pancreatic diseases like chronic or acute pancreatitis can lead on to dyspepsia. How do we investigate these patients when they come with the food intolerance alone? How do we know that it's due to disease or because of faulty food intake? Generally, we will have different clues, whether they have recent history of any painkillers or whether they are any diabetic or a hypothyroid by doing a testing. And apart from that, we generally do other things like we do an investigations commonly in an endoscopy. Endoscopy is not a diagnostic method for every patient who comes with the dyspepsia. Most of the time, education itself and taking food as very small quantity in frequent intervals alone is sufficient for treating most of the patients with the dyspepsia, mainly the functional dyspepsia. The diagnosis, which also involves the ruling out mainly the pathological disease like peptic ulcer or cancer. Generally, everybody have a fear about endoscopy. Generally, an endoscopy is a simple procedure. We put a tube which has a camera inside. We gently advance the tube into the food pipe as well as into the stomach. We screen everything under a local anesthesia. Generally, we will give a spray, local anesthetic spray, so your throat will be anesthetized. In case of patients who have a fear of endoscopy, it can be done under intravenous anesthesia as well. And when we suspect a cancer or a ulcer in a patients with indigestion, when somebody who is having a loss of weight as well as loss of appetite, along with somebody is having a blood vomiting, or when they have anemia, passing a dark color stool or black color stool, and when they have a family history of cancer. So, in this situation, we definitely advise them to go for further investigation to diagnose any organic or pathological diseases. And we also suggest them to have a normal diet, avoid them basically any outside food. The medication which includes for a dyspepsia mainly for acid suppressions, drugs which reduces acid production, which helps to prevent the reflux as well as reducing the burning sensation. We advise them to take at least 20 to 30 minutes like omeprazole or a pantoprazole, like many combinations which are available in the market to reduce acid production. And apart from that, we give medication to push the food little faster. We call it as a prokinetic drugs which helpful. And there are many other medications which are available which can will helpful to reduce the dyspepsia. For example, somebody is having a hypothyroidism, treating the hypothyroidism itself will improve the dyspepsia. And diabetic individuals also control for proper control of diabetes reduces the incidence of dyspepsia or indigestion.